right, Murad, thank you for joining us this afternoon.
Thank you.
And what year were you president?
I was president from 2018 to 2019.
All right, so the immediate past president for one day.
Right.
How's it feel?
It feels like a lot has changed in one day.
All right, so last year, what was your most memorable experience during your year as president?
I think when I first became president and I had a moment or a few minutes to address the combined membership at the business meeting, that was an experience not so much about me, but it imbued me with a sense of responsibility that there's this amazing society that I have been given the opportunity to lead for a year. And I felt that it was an immense privilege, but also a tremendous responsibility.
That's true. And I like what Mark said yesterday, don't mess it up. What were the biggest issues facing the society this past year?
Some of the issues we've been facing have been outside the society, the environment outside, specifically the regulatory and the legislative environment and even the insurance environment in which we work. There are a lot of external forces that are making it difficult for us to provide the best possible care to our patients and to use our clinical judgment as the guiding entity that sort of leads us to the right place. So I think among the issues we faced were making sure that dermatologists retain the ability to mix medications to optimally treat their patients in office. And I think that's one that we've worked really hard to overcome.
That's great. And what do you think the biggest innovations in dermatologic surgery have been in the last year or so?
I think we are facing a period of impending innovation, and among those are some substances that are biologics and stem cells. A lot of this stuff is on the cusp. It's not quite ready for prime time, and we need to be careful about how we go about getting it ready and make sure that we do it in a way that's supervised appropriately and that the various regulatory authorities are comfortable with. But I really think we're facing the imminent arrival of a new batch of therapies, if you will, that'll be more sophisticated and more targeted than what we've had in the past, and that will hopefully be living therapies that work with the patient's body in a way that's optimal for them. I think one other innovation, and this is more of a procedural change than a specific procedural itself, is that we are now 5 years into the creation of the Cosmetic Dermatologic Surgery Fellowship. And that is an innovation that is the gift that keeps on giving. We are creating the next generation of smart, ambitious, creative dermatologic surgeons, and ASDS has a tremendous role in ensuring their training and bringing them to a point where they can be independent investigators and thinkers.
Yeah, for sure. Thinking back on your patients, do you have a patient that sticks out in your memory as being, particularly memorable?
I can't say I can think of a specific patient, but the general class of patients I find most memorable and often most inspiring are my really old patients. I think when they're 85, 90 and they've had the good fortune to retain their health and their cognition, they have tremendous wisdom to offer. And while we're working on them, I ask them about their lives and what they've learned and what advice they might have. And it's always very thoughtful, and I feel like it's something that I can use not just as a doctor, but as a human being going forward.
Do they give a common thread as to what the secret is?
I think the secret is patient perseverance. It seems that a lot of these people, like all of us, have been through a lot, but they've managed to retain their humor and their commitment to their families and their careers, and they've done the best that they can, and that gives them solace and peace.
Yeah, it's so true. I think the same thing when I'm, with these patients who are older, and I find those who keep their mind and their body active do so much better. Mm-hmm. In looking back in your career, is there anything that you would have done differently or changed in any way?
I think I would probably have gotten involved sooner with societies. I think I got involved soon enough, but I think the community of dermatologists is such an amazing group of people that we all benefit from each other's knowledge and mentorship. I think one other thing maybe would be that I would be more active in advocacy early on. I hope for our younger members that they consider that as well. I think we have a unique opportunity among our younger members in particular to elevate them to positions of responsibility in our government, in our regulatory authorities, and so forth, and really communicate the immense good that dermatologists do so that not just we know about it and our patients know about it, but people who are in a position to make decisions to affect the environment and the method in which care is delivered know about it as well.
Very true. So what advice do you give the young dermatologic surgeons?
I suggest to them that they get involved. I suggest to them that they come to the ASDS meeting every single year. Even if they're really busy, they can always come for one day. And do something when you come here. If your talk doesn't get accepted, submit an abstract. That way you get some sense of return yourself, you're connected to the field, and that always gives back to you in the long run.
Very true. What are your predictions for the ASDS?
I think the ASDS is going to keep on growing and thriving. We have outstanding leadership. We have very engaged members. There's a lot to be done. I think we are leading in a lot of ways in medicine and dermatology, and I think that will just grow in the future as we grow as a society.
Absolutely. And so what advice do you give the leadership now that you've passed the baton on?
I think there are two things that have to be weighed. One is risk. We always want to minimize risk to the specialty, risk to the society. But I think at the same time, one of the great strengths of the society historically has been its nimbleness, its willingness to embrace change, its willingness to be a change leader and first out of the gate. And I think we really need to retain that capacity to lead not just our members, but the whole specialty of dermatology.
Mm-hmm.